everyone, and welcome to this EBP session on patient care documentation and athletic training. My name is Elizabeth Neal, and I'm a PhD candidate and doctoral fellow at Indiana State University. I'm completing my PhD in curriculum and instruction with an emphasis on athletic training education. And I'm excited to talk to you guys about some of the new and advances in athletic training documentation, and to talk about ways that we can improve or continue on quality documentation that you are completing. So as we begin today, I want to let you know that I have no disclosures. I have no conflicts of interest with the materials I will be giving, and the views are all my own. Additionally, the views are not necessarily those of my colleagues or Indiana State University. Lastly, I want you to use your discretion on any of the information that I give to you today. So as we begin, a result of this session, we're going to have learning outcomes. And so the first one is to identify common mistakes within your medical documentation. And I want you to take this session not as a way that I am bashing what you are doing or that you are a terrible athletic trainer in what you document, but rather that there are ways to continually improve and for us to always get better in something that we do. Second, we are going to facilitate measures of quality improvement, and that may be a term that's not familiar with you right now, but we'll talk about what that is and how to accomplish this, specifically for medical documentation for you to share with yourself, your peers, or the athletic training students that you work with. And lastly, you're going to demonstrate knowledge of healthcare informatics, including medical documentation best practice. So what is medical documentation? That's the whole reason you're here today, and it's probably something that you've already thought about before. And so as we continue on, why are you here today? So I'm sure your clinical education coordinator required this as part of your yearly preceptor training. I'm sure people also saw that there was 2 free EBP CEUs available, and so that's something that you latched on to with next year being a reporting year. But what I want to challenge you is to think about the continuing education that you do. Think about why you're choosing it, and realizing that medical documentation and that domain 5 of healthcare informatics and different parts of administration that people hate thinking about is so important too within your everyday practice as an athletic trainer. We're going to take a moment and reflect before we get into the what, why, and how of what medical documentation is. So I want you to think back to the last day that you provided patient care to whatever population you work with. How many people did you see throughout the day? Was it something that you were able to go in and document right away? Was it something that maybe you did at the end of the day, a day later, maybe a week down the road? Maybe you still haven't documented those patient cases yet. Let's think about the why. How busy were you that day? Think about the overall medical documentation that you did complete. Was it quality work? Is there a lot of details so another athletic trainer could see it? Is there some dates missing or times missing or information from an evaluation missing? Think about the positives that you did. And then take a moment and think about some of the things that you would like to improve. These are not necessarily things that you're going to be sharing, but I want you to keep this in the back of your mind as we go through this EBP home study. In August of 2017, the National Athletic Trainers Association put out the best practice guidelines for athletic training documentation. And although these are not as prescriptive as, say, PT's guidelines, they are a good general guidelines for athletic trainers to follow. And I was lucky enough to be a part of this work group and get to create this document. And it's within your home study, so you're able to click into it and actually read this document to kind of aid you in assisting in what you're going to know throughout the rest of the home study that we're going to go through. And so it gives you definitions and generalizability of ways to know what you should and shouldn't document for the patients that you see every day. Another thing I want to talk about early on is what exactly are we talking about with medical documentation? And this includes medical records as a whole. So oftentimes athletic trainers think about things such as initial evaluations, and that is what you think of with patient care documentation. But we also need to think about daily notes or discharge notes. We also need to think about communication that may occur that should be within the patient's record, any immunization forms that they have, a consent and release to treat, a full background of the patient's history, of anything that they have going on with them. And I think that this is important to keep in our minds as we're going through because, like I said, oftentimes we have that initial SOAP note, old format that we think about, and that's all that we do. And so as we continue with this home study today, we're going to talk about a lot of these different ways and what we can do to improve your patient care documentation.